Welcome back to Veterans Forum, a program by veterans, about veterans, for veterans and their families. I'm your co-host, Bob West, with Ray Chattery and Jerry Devlin. Our goal is to provide important information to you and your family about legislation, benefits, and support activities by interviewing leaders in our community. Jerry's on assignment. So Ray, who do we have with us today?
We're proud to have Mr. Dennis H. Smith, who is the Director and CEO of the VA Maryland Healthcare System. Mr. Smith was appointed Director of the VA Maryland Healthcare System in May of 1995. And at this time, I'll interject. I'll let Mr. Smith go into detail on his duties, what the Maryland Healthcare System does, and how it works later in the program. Dennis is a native of Baltimore and received his Bachelor of Science degree in Business Administration from the University of Maryland College Park, Master of Business Administration from Loyola College in Baltimore, and a Master of Hospital Administration from George Washington University in Washington, D.C. He began his VA career at the VA Medical Center in Washington, D.C. as a hospital administration in 1973. He went on to hold management level positions at the VA Medical Centers in Erie, Pennsylvania, Richmond, Virginia, and Jackson, Mississippi. He also served as adjunct professor at the University of Alabama, Birmingham, where he was a preceptor to graduate students studying healthcare administration. Prior to being appointed to his current position, he served as Chief of Staff to the Undersecretary for Health, a senior level position at the VA Central Office in Washington, D.C. Mr. Smith is a fellow of the American College of Healthcare Executive, which is ACHE, and is the 2011 recipient of the ACHE Regents Award in the Senior Healthcare Executive category. He served on the boards of directors for the United Way of Central Maryland, the Maryland Center for Veterans Education and Training, which is McVet in Baltimore, and the Baltimore Research and Education Foundation. I've known Dennis for about 10 years plus now, and he's always been there to pay tribute to veterans at various VSO conventions and at the Veteran of the Year award ceremonies. We're very privileged to have Mr. Smith be our guest this evening to let the veterans and the viewing audience know how they can receive their VA benefits here in Maryland.
Welcome, Dennis.
Thank you, Bob. It's good to be here.
Thank you. Tell us a little bit about the Maryland VA Health System.
Well, the VA Maryland Healthcare System serves veterans in Maryland, and we have 3 inpatient sites, our acute facilities downtown Baltimore. We have a long-term and a mental health facility up in Perryville, and we have a long-term care facility at Loch Raven, which also has some hospice beds. We also have 5 outpatient clinics throughout the state, and also have outpatient clinics in 2 of our inpatient facilities, Baltimore and Perry Point. And we're adding a 6th outpatient clinic at Fort Meade, which is currently under construction. So we're excited. We serve 54,000 veterans. We have about 9,500 admissions a year, and we have fabulous staff. So,
you know, one of our jobs is to get the word out about support and benefits that are available to veterans and their families. And we want to stress that you have to get enrolled in the process, because that's where it all begins. And we do our best to try to get our veterans enrolled. And I'm sure that that's one of the focuses and goals of the Maryland system, too.
It is. I would encourage all your viewers to, if they know a veteran or if they're related to a veteran, have them enroll. It costs you nothing to enroll, and you can get into the system. And if you need it, you can use it. If you don't need it right away, you can come later on when you might need some health care.
And we know there's a lot of programs and funding going into the VA to help improve the benefits and support for our veterans. And one of them is at the Fort Howard campus. Do you want to tell us a little bit about that?
Yes. I think as most of your viewers may know, we closed the Fort Howard facility in 2002. And what we did is develop a project that we had people bid on. And the project at Fort Howard is going to be an enhanced use project. That's the legislation that the VA has. And what the developer will do is build out the campus, the 95 acres. It'll be assisted living, independent living, and a nursing home. And it really is a great project. The developer has been selected. He has not signed a lease yet. The VA will give him a lease. The legislation lets us lease the property for up to 70 years. So our central office real estate people deal with the lease, and they are working that now. We're hoping to have the lease signed by September, and we're looking forward to an early fall groundbreaking. So this is really exciting for us.
Now, will this facility only be for the veteran, or would also some spouses be able to live there under assisted living or something of that
No,
nature?
spouses will be able to. The way the project is developed, veterans will get priority and discounts, but actually it will be open to non-veterans also. And the reason we have that is because our VA central office, through experience with this enhanced use leasing process, noted that developers couldn't get finance unless they opened the project up to a larger group of people. We feel there's enough veterans in Maryland that most of the facility will be filled with veterans. So we're not really concerned about the non-veteran, but in order to get finance and develop the project, they had to open up the non-veterans.
Yeah, from time to time we see it with older veterans who have passed away and they have a spouse behind, and they're wondering about that kind of support. And this is great to hear that it's something that's going to become available.
Right, and the spouse will be able to continue to live there. And also part of this project is a developer, part of the contract that he will sign, the lease he will sign, he has to build us a brand new clinic. So we have a clinic out at Fort Howard. It's in an old building. Part of this process will be that we get a new clinic. So we're excited about that. So on the campus, we'll have our independent living, assisted living, and a nursing home, and we'll also have, the veterans also have an outpatient clinic there to access. So it's a great, great project.
Outpatient clinics are extremely important because so many services now are in and out, and
Yes.
it makes it more convenient than the traditional hospital setting.
Right.
Yeah.
And the staff at Fort Howard, we have a clinic there now, is excellent. We get a lot of great compliments about the staff, and that same staff will move to the new clinic. So you'll be able to keep your same doctor. The clinic will just move up front in the property. So it's going to be, the whole project going to be a real benefit for the veteran community.
Mm-hmm. Right?
Now, one thing is that a lot of the people in this area would go to the Washington VA, but I know everybody, they're trying to get everybody to come up to Baltimore now in this area. So what is happening at the Baltimore VA Medical Center that will, you know, that our viewing audience should know about, to where they can go up and get this service?
Well, first of all, we have a couple new programs. We've just been approved for lung transplants. That's a national program. The VA has only one facility, Madison, Wisconsin, that does lung transplants. They've asked us if we would be willing to do lung transplants because of the skills of our surgeons who are on our staff. So we agreed to do that. So even though that won't affect a lot of people in Maryland because we'll be taking national referrals, it's a good indication of those veterans in the community of the quality of services we have and what central office thinks of us clinically. So that's a real feather in our cap. The other thing we're doing is developing a radiation oncology department. Now, we've cleared out some space in Baltimore, and we've gotten a project funded, and we will build out radiation oncology. Now, you might ask, what's radiation oncology? For those people that might get cancer, cancer is treated primarily in three ways: surgery, chemotherapy, and radiation. And the radiation therapy is what I'm talking about we're developing. Right now, our surgeons do the surgery and the chemotherapy, but our veterans have to go outside our campus to a hospital that we contract with for the radiation. We bring it in-house. We'll save about $1.5 million a year, and it'll be much more convenient to our veterans because they'll have all the services, if they get cancer, right there in Baltimore. And it really is patient-centered care, and that's what we're really stress.
Now, you're talking about lung transplants. Are there any other transplants that the VA does?
The VA does most transplants. We don't do them here, like liver transplants are done up in Pittsburgh. So if somebody would need a transplant surgery, they could come to us and we can refer them to another VA facility that does it. There's not a need for all VA facilities to do transplants, so they select special sites for those transplants. And then the VA will send the patient and his family to that site to get evaluated and surgery if he needs it.
Well, that's an important service, and I don't think a lot of people are aware that the VA is that extensive in their medical care.
Yes. Yes.
So why don't you tell us a little bit about Loch Raven, too?
Okay, Loch Raven was the old site for our Baltimore facility. And what we built at Loch Raven, we tore down the old hospital, and we built which was called, 10 or 15 years ago, a nursing home. They're now called Continuum Living Center. So we built that back 15 years ago, and it's just evolved. We've put hospice beds in it, some rehab beds in it, and we outgrew the space. So we're adding a 20,000 square foot addition onto our CLC at Loch Raven. So that project is underway now. It's under roof. We expect it to open probably in March. So we're really excited about that. We're going to move our rehab facility in there, occupational therapy, physical therapy, and what's called kinesiotherapy, as well as recreational therapy in there. Also with this, we will get a chapel. And what's important about that, they never had a chapel. We would use the dining room for the chapel. But now that we've added hospice there, there's more of a need for chaplain services at the facility. So that'll be great. We also just renovated our hospice unit. It opened 2 weeks ago, and it's lovely, state-of-the-art. What we call plane-free rooms. It really is a great hospice unit. And then the other project we have at Loch Raven is a new research building going up. In the back of the facility, back near the outpatient clinic, that construction is going to be a research building to do various research for the aged type research. So we're excited about that too. That project probably won't be finished till next summer.
Well, that'll give Ray and I enough time to get ready for something like that, because we're going to need as much geriatric care as we can get.
Right. Now, as I say, you mentioned Loch Raven. Are there any plans for additional outpatient clinics throughout Maryland?
Yes. As I mentioned earlier, we are building an outpatient clinic at Fort Meade. It's going to be adjacent to Kimbrough. And we plan to we already have some contract services with Kimbrough. They do some cataract surgery for us, some outpatient cataract surgery. They're not an inpatient facility, but they do some outpatient surgery. So they have imaging and lab and things like that there. So what makes this partnership so nice, we'll have our CBAC, our outpatient clinic there, but if somebody needs an image, they can just walk right next door, and literally it's 20 feet away to get their image. Right now, if they're in our Cambridge or Fort Howard location, Glen Burnie location, if they need an image, we've got to send them to Baltimore, or on the Eastern Shore, we use one of the local hospitals there. But it'll be real convenient for the veterans. So we're excited about this partnership with Fort Meade.
And I think there's more of that as I travel around the country, the partnership between military hospitals and the VA, which seems to me to make a lot of sense.
It does. We'll be doing some discharge exams for them. So we're really excited about the veterans that are being discharged from the service. Will be able to come to the VA and get like a C&P exam. It won't be called a C&P exam, but they'll get evaluated if they have some type of injury or disability. And then they won't have to go get a C&P exam. They will already have gotten these. It's called a DES exam. So we're excited about starting that program up with Fort Meade. So it'll be a benefit to everybody.
When